Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today we're jumping into Availity's acquisition of Diameter Health. And here to tell us all about that big deal is the CEO of Availity, Russ Thomas, and Mary Lantin. She is the president and COO of Diameter Health. So, congratulations, you guys, on this deal.
Thank you.
Yeah, thanks,
Super
Jess.
excited.
All right, so excited to get into this. Russ, let's start with you. I mean, tell us a little bit about what this does for Availity, because you guys have been around since 2001,
The
working
dawn
on
of
claims
time.
data. Yeah. And now you've got this clinical data startup that you've acquired and integrated in. So what does this do for
Yeah.
Availity?
Yeah, thanks, Jess. Well, thanks for having us, and very excited to be here with you today. And we're just like incredibly excited about this acquisition of Diameter and the combination of the talented team of leaders and talent at Diameter that's going to be joining the Availity team. I mean, you know a bit about Availity, right? We have a very simple role in the world as we see it, and that is to, eliminate, right? Let's use the big word. Let's eliminate administrative waste in healthcare. Let's simplify the business of healthcare. It's what we've been about now for 20 years. And to get to your question of, why Diameter, it's been very clear to me for years and years and years, right? Back to my days in my prior company doing, clinical data exchange and driving, in that particular case, pharmacy information, that the intersection of clinical data with administrative workflow has been woefully absent in healthcare. And as a consequence, you get a tremendous amount of friction and abrasion and disruption in the practice of medicine, right? Physicians having to stop what they're doing to, determine if an auth has been approved, or if a claim is going to be approved, or to make sure that it's coded properly, or to, help make sure the right attachment, the right data is associated with it. And when you really boil all that down, it is part of this sort of ongoing relationship between providers and health plans. Providers want to practice medicine, right? It is they practice. It's not perfect, and so you need to give them the bandwidth to be able to practice. And of course, health plans have an important role to managing cost and expense and utilization, and all the things that, if left unchecked, can drive healthcare costs to an even higher rate of growth than we've seen over the last 10 or 15 years. So enter into that this relationship that we now have with Diameter, where we are now going to bring clinical data at scale, which Availity has been moving clinical data for years, but now to have Diameter and this upcycling capability that Mary will talk about, which from my perspective is really the ability to take raw clinical data and refine it into concepts and data elements and digestible bites that a health plan can use in a workflow to automate an administrative process with a provider. And so again, we always go back to our North Star, right? Eliminate waste, reduce friction, reduce abrasion, make it easier for healthcare professionals to do what they're trained to do, which is to practice medicine. And that's why we're so excited about it, right? And that's why we're just thrilled to have Diameter join us.
All right, Mary, he set you up perfectly here. So explain to us what Diameter does, because truthfully, so it's like we hear about the business process side of this that Availity has so much experience, so many years of traction with, and now you're bringing in this whole data upcycling thing. So when I first read about Diameter, I mean, I'm reading this, and there's a lot of these API tech companies that are bringing the claims data, or not, sorry, not the claims data, the clinical data together, standardizing it, firing it, whatever you guys are doing over there, aggregating,
All the above.
all the above. So tell us a little bit about what you guys do at Diameter so that we can understand exactly which flavor of API tech company you are.
Yeah, no, Russ set it up perfectly. Really our mission as a company is to make data actionable and relevant and usable. And as you know, there's just so much data out there, and it's a mess. The clinical data, we're seeing more and more of it. It's not making sense. And what we do with upcycling is truly mapping that data and normalizing it, validating it, and organizing it so that we, at the end of it, through that refinery, is really usable data that's mapped to standards, so that we can actually speak a common language. And where we fit with Availity is this amazing network, both on the payer side and the provider side. And it's a perfect, I couldn't have picked a better place in terms of we are in the middle. We don't own data. We don't have connection. We have connections to data, but people who have the data come to us. Different clients who have the data come to us, and really to help support those different use cases. So really, the power of coming together with Availity is amazing, because they're the supply chain, and there's so much data that can bring so much value in terms of, after having gone through that upcycling process, that will make it usable downstream.
Russ, what was it about Diameter in particular? Because I mean, when I look at this space, there's a lot of players that do similar things. Is it like, I mean, I always think of Availity, going back to my Blue Cross days, as having that Blue Cross background. I know that Diameter's got Centene funding, Optum funding. Is it like that common health plan backing? Or is it something else that really attracted you to Diameter over any of the others that were kind of out there?
Yeah, I think sort of at the highest level, it's what Mary described. I actually don't think things are, look, you've been around healthcare for a long time. There's a lot of companies that talk about doing a lot of things. We had done diligence on a variety of companies in the clinical space that, put on good PowerPoints, which, turns out is a lot easier than actually executing on this very complicated clinical data upcycling, standardization, rationalization process. And so we did our homework, right? We did our background evaluation, did our homework, and ultimately concluded that of all the companies out there who are representing the capability to do what Diameter does, there are really few and far between that have had any meaningful success in executing on this mission, because it's hard. This is really hard, right? I mean, remember, providers speak one language, payers speak another language, right? It's HL7 on one side and X12 on the other, and there's a lot of disparity between the two. And so, identifying a firm that it could actually take data from the provider and translate it in a consistent, efficient, effective way into data that a plan can actually automate the consumption of into their business processes. I'm going to tell you, Jess, there are not many companies that do that. And just like Mary said, I think this intersection of our vast network, I mean, Availity will transact 13 billion transactions through our network this year. Raw claims billed through Availity at, close to $2.5 trillion, right, of claims billed through our network this year. So we have a lot of data, right, flowing through our network. We have a lot of engagement with, over 2 million providers in our network. So our ability to connect to the endpoints and then connect back to, the health plans, think about us as really a two-sided network, right? To do that at scale has been proven over and over again. Now, right, the objective for us is, well, let's start making that network smarter. And that's really how I think about Diameter, right? Diameter enables us to make our network much smarter than it is today, because we can bring life to this raw, unstructured clinical data that we're able to get out of plans and push back to or out of providers and push back to plans, and then bidirectional, right, to be able to exchange it in both directions. Because, as I'm sure we'll talk about, what I fundamentally believe is, when there's value for a provider, there's also value for a health plan, right? This sort of historical, push-pull, tug-of-war between providers and plans it's there to a point. But what we've proven over and over again is this trusted intermediary between plans and providers is, if I can make a process more efficient for a provider, the health plan is going to derive value from that. And likewise, if I can make a process more efficient for a health plan, that's going to make the provider's life easier. And that's really what we are focused on. We're not in the business of sort of trying to favor one over the other or make it easier for a provider to bill something that shouldn't be billed, or to charge something that shouldn't be charged, or make it easier for a health plan to deny, a claim. Our job is really to make it easier for these critical stakeholders in healthcare to do business with each other. And again, that's what Diameter helps us do.
Yeah, and just to piggyback and loop back in terms of, I didn't give the nod that's truly deserved and required, is the reason that we can do this is the company was founded in 2013 when we started in the HIE market, because we knew that was where there was access to data in high volume and from all different sources, and really blood, sweat, and tears in terms of, we've seen so much data and really spent a number of years understanding that data with a number of clinicians. And clinical informatics is truly it is truly what this whole concept and of upcycling has been built on. And so it's just years of knowledge that we've been able to scale. And I think, in my past life, I've worked with clinical data. I think we did a good job, but you do it with people. And it's a lot of work to map those different concepts. And so I need to stress the scalability of it is so important. And I think that's why it's a great partnership. Give us more data, we can push it through. But that has taken a lot of time. And, the team has done an amazing job in building that capability. But I think, purely based on those capabilities, I think that's why we're together.
Okay, so we have to double click on the scalability word here. And what I want to do though is I want to hear about the future of the scalability. Okay, so it's like, I know the acquisitions closing in Q3, sure. But talk to me about next year, the year after, like the full bore vision here of what bringing Diameter into the world of Availity will be able to do. Because this is like you start seeing, in the press release, the words like interoperability platform and like the largest, ability to look at both claims and clinical data. And it's like the mind starts to reel. And, we've already started wading into the word value. So why don't we just add the based care to the end of that and talk a little bit about what having this type of platform network, in Availity, like sum total now with Diameter included, what does this look like, moving way forward into the future? And Russ, why don't we start with you? And then Mary, I want to hear your thoughts.
Okay. I'll start. I think that all care should be value-based, irrespective of the billing model, right? I mean, I think again, we've sort of conflated billing models and care models in ways that aren't necessarily good for the consumer, the end user. So I don't believe that what we're doing here is limited to or specific to, a value-based model as those evolve, or a fee-for-service based model. The reality is in any engagement between a provider of care and a patient, the ability to empower that provider with as much knowledge as possible about the person they're taking care of is critical, right? So, as I think about it, right, the future and where we're going, it's, right patient, right information, right time, so that providers can make an informed decision, informed care plan, irrespective of how their administrative staff are ultimately going to bill, the payer, right? Whether that payer is a health plan or an employer or a TPA or whatever, or the individual. So I think look down the road, right, at where we're going, there are almost too many opportunities to impact that care delivery model with quality clinical data, whether it's, let's talk about the ones that we know are problems today, right? The bane of providers' existence is the authorization process. It's kludgy, it's uninformed, it's complex, it's frustrating, it's payer specific, right? If you've done an auth with one payer, you've done an auth with one payer. So to be able to now, automate that authorization workflow through quality data that can be machine engaged with the payer's system is going to drive tremendous value to both the payer and the provider. From the payer's perspective, and Mary will talk about this more because she knows it intimately, is to be able to automate that HEDIS workflow and care plan management and things like that on the provider side, right? So they're not having to pick up the phone or go looking for charts or whatever it may be, is going to bring tremendous value to that provider, again, sort of irrespective of what kind of business model they're operating under. So what I think you'll see us do, if the bet is a good bet, which I believe it is, then 2 or 3 years down the road, you will see us continue to grow our network, right? We talk about our business as this sort of the snowball, you get it rolling down the hill, and this cycle that we have. Now we're really starting to add new capabilities, new features, new competencies to the network, and clinical data is a huge part of that. So just as we've automated things as simple as benefits determination, right, which always used to be a phone call or a fax, or frankly just ignorance. I think you have coverage, and so I'm going to figure it out after the fact. We've automated that, right? We do literally billions of eligibility, benefits, coverage determination, transactions through Availity every year. Now it's trying to move up that value chain into some of these more complex because they're more subjective business cases and workflows that just demand automation.
Mary, chime in here.
Yeah.
What does that future of this whole platform look like to you? I think, like, I love what Russ said here. It's not necessarily business model specific to any one
No.
type of payment model, which I think is really interesting. But I mean, from your perspective, I mean, like, as you look ahead at the joined vision of what the new Availity with Diameter in it is capable of doing, what does that look like for you?
Yeah, I think in the here and now, the opportunity is amazing and the network will grow. But we're so excited to be in the middle and have access to the data, but also be positioned in this dual side network to be able to get the data that is more informed and intelligent, using machine learning and getting it to the point where it can be used, whether it's a payer or provider. And I think the different use cases, I think it's agnostic. There are so many things that we can accomplish from a clinical standpoint, a financial standpoint, and operational. And it's really establishing the network and having the data flow through so it can get to the places where we can make an impact. And so I think in its fullest form, you will see us everywhere, truly, in terms of driving value. And that can be measured in lots of different ways, from a clinical standpoint, from a financial standpoint, and efficiency standpoint.
All right,
And
so I have to ask about this because I feel like, as you're talking, I want to understand what the competitive advantage is going to be for Availity then moving forward with Diameter as a part of it. I mean, already you guys are so big at scale, 20 years. Like, I mean, just it's incredible. And so I'm curious, Russ, I'll ask both of you this, but I'm starting with Russ again. Tell me, what do you think the competitive advantage is moving forward, particularly as we do see a lot of tech companies jump into the space that Diameter is in and then try to leap over to where you're at, or vice versa?
yeah. So I'll say a couple of things. One, I do believe the rising tide raises all ships. So I'm thrilled that there are competitors in our space. They make us better, right, every day. We think we've built something pretty unique. You touched on it, in one of your questions around sort of our ownership model and equity structure. And I do believe the fact that, a large chunk of our ownership is some of our largest customers, our health plan customers. It really gives us a couple of things that I think are differentiating and, make us, even, big competitive advantages for us. One, you get a lot of insights into really what's going on within these large health plans and sort of how they're thinking and where their models are evolving. And that's super valuable. We've got 8 senior executives of health plans on our now 13-person board. And so it's great to have their feedback and insights as board members and leaders of their company. It also gives us quite often a place to go, a sandbox to go test things out, right? Between our investor health plans and our other premier health plans, we now have over 30 health plans that are premier to Availity, which means they are in, I'm careful about using the word exclusive. So we'll say designated business relationships with us where, the vast majority of all their provider connectivity flows through Availity. So between those forums, I think we have an incredible sandbox to operate in and to test models and to test use cases that frankly others don't have. I think the other thing, candidly, that's a competitive advantage for us, and now I'd say for Diameter as well, is if you do look at our equity structure, and it's largely health plans, but we have private equity investors in as well. You may have seen we recapped last year with Novo Holdings, which is a phenomenal investor, really a long-term strategic investor for us. We got a lot of runway. Unlike a lot of these companies that you talk about, which are, fairly newly incubated and hugely private equity backed and have taken on a lot of debt. We've been very smart with the way that we've run our business for the last 20 years. Very low leverage on the business, very long-term thinking investors. So we do things like go to our board with plans that say, look, last year we made X amount in EBITDA. Next year, we're going to grow revenue, but we actually want to keep EBITDA flat or even take EBITDA down because here are the investments we want to make to grow the business for the next 3 to 5 years and get 100% support for that. And I think that's very unique for a company, like ours, who been around for a long time, to be as aggressive in innovation and investing in the future, as we are, with the full support of our investors and our board to do that, I think that's a real competitive advantage for us.
Absolutely. All right, Mary, what would you add to that? I mean, especially because like now it's like you just like upgraded into this family. Not that
Oh,
you
I feel upgraded, believe me.
Oh my God. I mean, like, well, like, I mean, by comparison, it's like Diameter, like Availity's, you're backed by these big plans, like $200 million in capital raised, from their private equity funding. And like you guys, just shy of 30 million is what I read right before you guys got acquired. So it's like, what do you feel is the competitive advantage stepping forward? I mean, being, part of this, whether you want to speak to it from, as you guys grow the Diameter tech within Availity, or what Availity sum total will look like.
I think it's really both. I mean, the diameter tech within Availity, I think we're complementary in the best of ways. And I think the 1 + 1 = 11, I think will really come to fruition. And I think that is going to be the competitive advantage, because if you look at other players out there, they're all going to have strengths and weaknesses across that spectrum. And I think, self-proclaimed, we were a niche player. We are very much in the middle, and we're very strong at that. And so we often came against folks who were end to end, and now we are part of an end to end and help strengthen Availity. So I think that is the competitive advantage. And from a scale standpoint, in what we do, I stand behind that. In terms of just scale, for us is the speed and the quality of the data that's upcycled, and that is going to give Availity the differentiating factor. And there's so much data that we can use to show that going forward, and looking at that impact.
Okay, last thing for both of you. What's next in the shorter term? Like, I know the deal is going to close, blah, 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 all of that stuff. But like, I mean, looking like into the nearer term here, I mean, I feel like this space that Diameter is in particular, and also, I guess for you guys, Russ, hearing a lot about how this part of the market, this data exchange, this data upcycling, all that poised to just pop thanks to these information blocking rules that are coming out of 21st Century Cures Act that are about to be implemented. I hear like, that's like, I watch this space, everybody's saying. I mean, the creation of a longitudinal patient record and making that available to a patient. I mean, like, give us a little bit of foreshadowing here on what we can expect coming out the gate here on this partnership. What do you guys think?
You want to go first? You want me to take?
Yeah,
Sure,
I
go
love
ahead.
that you said the longitudinal medical record, because we haven't touched on that, because that is it, right?
That is it.
I mean, we will be able to, what we're able to do today is really take clinical data from multiple sources and put it into one. But I could not be more excited to layer in the claims data and truly, from a data integrity standpoint, have that, right? And I think that is what's going to power all the different value discussions we've had in terms of the impact. That is going to be underlying it all. And that's why the platform and the network is so powerful. But it's really, we're positioned, short-term work, companies are coming together. We have our roadmap, and what does it look like in parallel and together? But underlying that is absolutely that longitudinal medical record that is fully integrated from a clinical and claims standpoint.
Does that end up going to a patient or no, in your vision, or not there yet?
In my vision, yeah, but we haven't talked about that.
Okay. Put that on the agenda then.
No,
All right, Russ, what do you think? The immediate next? I mean, Mary's eyes lit up when we said longitudinal record, but
I think Mary's right.
what lights you up?
I think Mary's right. And by the way, I fully support. It's got to go to the patient. Why would you not go to the patient with it? I mean, aren't we tired of walking into our doctor? And I love my, I go to Mayo for my annual assessment, right? And I walk in, and the first thing my doc asks me is, well, how are you feeling? I'm like, I feel okay, right? I mean, shouldn't the first part of the conversation be, look, I've got your record, you have your record, right? Into that record, I'm a data junkie, right? I measure my own data religiously. I wear a continuous glucose monitor, not because I'm a diabetic, because I'm trying to figure out how to optimize my athletic performance by the way I mean,
wow.
I love that. I can't wait to walk into my doctor's office with, months of glucose monitoring.
Oh, I'm
data.
sure he can't wait to see you either, coming in
sure
with that.
But I mean, by the way, it's kind of a passion of mine right now, as people keep telling me I'm getting older. I guess I am. But it's a little bit of a passion of mine to, I fundamentally believe that we can live longer, healthier lives if we know, if we have access to the right information about ourselves and we put that information to work, right? So if all I do is take this data and do nothing with it, then it's just wasted, it's wasted energy. But to take the data that I'm gathering on myself and then integrate that, a true longitudinal record, right, is not just what happens to me on the rare occasion that I'm in the healthcare system, right? So what happens to me every day, but the intersection of that, daily collected data and what my doctor knows and what my blood work shows and all that sort of stuff is where the real magic lies. And, one of the problems I have, I'll be philosophical for a second, right? One of the problems I have with this healthcare system in the US is it is a reactive system, right? We go to the doctor when we don't feel well or when we have an accident or when something happens to us, as opposed to proactively engaging in managing our healthcare every day. There's a great new initiative that my friend Dave Wickman started, this human-powered health concept, which is really all about learning learning everything there is to know about ourselves from a health perspective, and then actively managing our healthcare day in and day out. And what we're doing now with Availity and Diameter is bringing all that, reactive, here's what's happened, here's what the providers should know about us today, to create that intersection of sort of that daily management of our healthcare. Is where I think we can just bring a tremendous amount of value to people like hopefully all of us on the phone who aren't in the healthcare system every day, right? Obviously, what we're focused on now, what Availity and Diameter is focused on now is, $4.5 trillion of annual spend in the healthcare system. $1 trillion of that is administrative, and some big chunk, I don't care whether it's 25% or 30%, some big number, right, that you measure in the hundreds of billions of dollars is waste. So the TAM, the addressable market for what Availity and Diameter are going to do together is huge. And my view is you're just starting to scratch the surface about where you can start to impact people in their daily lives outside of the healthcare system. And so to me, that's a big part of what's next. It is a longitudinal record of a patient that can get applied in any setting, that can be made available to, my provider in any setting, so that I can have a more informed healthcare experience. That's bound to lead to better results for everyone. It almost has to, because I do believe, transparency is key. And that's what's missing in the healthcare system today. So it is, like I said, it's a bit of a passion, project for me to bring this data to life in ways that, my physician and your physician and the people providing care for us can actually have an informed conversation with us versus, well, tell me how you feel, right? I mean, I feel about the same as I did yesterday. The question of how I feel today is how I felt a year ago or 2 years ago to compare to how I'm doing today, right? Not how I feel. So that's where I think this ultimately goes. I love, you remember Bob Lafrano, right? Who was the CEO at Florida Blue, probably while you were there. Pat may have been there when you were there, but I don't know if Bob was there or not, but I met with Bob early on in my tenure at Availity. And I remember I was off on one of my I've been on this clinical bandwagon for decades, right? I was off on one of my bandwagons with Bob about, clinical data exchange, and you got to be able to do this and Bob, who is a doctor, looked at me and goes, Russ, let me tell you, the 3 most important things to a provider in order of importance: getting paid, and getting paid, right? And he was a little tongue-in-cheek about it, but his point was, he goes, if providers can't trust health plans to pay them accurately and timely, they're never going to engage health plans on care management and better clinical outcomes and all the stuff that, frankly, most providers think plans don't have any business, engaging in, right? So the point of that story, other than I just have a lot of respect for Bob, is we got to fix the basics, right? There's a lot of basic stuff that I think Availity's done a great job of up to this point. I think Diameter has as well. Now with the combination, we can start to get at some of these more complex administrative business use cases that drive a ton of frustration. And the one thing I would add to what Mary said is continue to build trust, right? It's about a longitudinal record that you can trust. And, one of the things that Availity has been very cautious about for 20 years, and we've affirmed this now as part of our strategy, is we don't sell data, we don't license data, we don't make data available to third parties for commercialization, right? Because, and our competitors do at scale, we're leaving tens, if not hundreds of millions of dollars on the table in revenue, because we think that having that trusted intermediary status, right, where my providers don't sit there wondering, well, what are they doing with my data, right? We're very clear what we're doing with your data. Nothing that you don't tell us we can do. And we're not asking you for anything that's not being put to work in a use case or a business case that will benefit you as a provider and the health plans you do business with. And I think the combination of the technology and the network and the trust is where we really get something special between Availity and Diameter.
Well, I'm fired up. I mean, I had no idea. Like, okay, holy grail of longitudinal patient record was going to just set both of you off like fireworks. I love it. This is great. I see where the passion has come together as well. So that's really exciting. Well, you guys, let's leave it there. I mean, I don't know how we could come up with a better way to close this conversation out. So I'll just say thank you. Thank you so much, Mary and Russ, for coming by and just talking to us about not only the acquisition, but the mind-blowing stuff that's really got you fired up about how to take this to the next level. Very exciting. I'm so excited.
Thank you for having us.
Awesome. Well, thank you guys. I mean, for more conversations with the who's who of health tech, as they're changing the way that we do healthcare very passionately, head on over to my YouTube channel. It's youtube.com/WTF Health. Thanks again, Mary and Russ. I'm Jessica DeMassa. I'll talk to you guys soon. Take care.